health crisis emanating from the Ebola virus outbreak. As noted in my letter dated 8 October 2014, I have invited Dr. David Nabarro, Special Envoy of the Secretary General on Ebola, and Mr. Anthony Banbury, Special Representative and Head of the United Nations Mission for Ebola Emergency Response, UNAMIR, to brief the membership on this pressing matter. I take this opportunity to warmly welcome the Deputy Secretary General, His Excellency Jan Eliasson, the Chief of Cabinet of the Executive Office of the Secretary General, Ms. Susan Marcora, and our distinguished invitees to this meeting. Mr. Anthony Banbury is joining us via video conference. By its resolution 69/1 of 19 September 2014, the General Assembly welcomed the intention of the Secretary General to establish the United Nations Mission for Ebola Emergency Response and called upon member states, relevant United Nations bodies, and the United Nations systems to provide their full support to the mission. Your Excellencies, Mr. Deputy Secretary General, Dr. Nabarro, Mr. Banbury, distinguished delegates, ladies and gentlemen, as we gather this morning for a briefing on the Ebola outbreak and the global response to the epidemic, let me begin by thanking the Deputy Secretary General, Mr. Jan Eliasson, for joining us today. Also special thanks to Dr. David Nabarro, Special Envoy of the Secretary General on Ebola, and Mr. Anthony Banbury, Special Representative of the Head of the United Nations Mission for Ebola Emergency Response, who will be briefing the Assembly on the latest development on this crisis. As you recall, in the very first plenary meeting of this 69th session, exactly 3 weeks ago, we adopted resolution A/RES/69/1, welcoming the Secretary General's initiative to establish the United Nations Mission for Ebola Emergency Response, UNAMIR. The resolution also called on member states and relevant United Nations entities to provide their full support to the mission. I'm pleased to note that yesterday, the Assembly approved preliminary funding required for UNAMIR. Also yesterday, global development leaders met in Washington, D.C. to discuss the critical issues, needs, and possible solutions for addressing the health and socio-economic impacts of the crisis. In that meeting, leaders underscored the potentially catastrophic economic consequences if the outbreak is not quickly contained. Excellencies, as you well know, the situation on the ground in the affected countries remains extremely precarious. On the front lines of the epidemic, humanitarian staff, nurses, doctors, burial workers, and ordinary citizens are doing extraordinary work at great personal risk. Yet, despite their heroic efforts, the epidemic continues to ravage the communities, with the death toll rising with each passing day. In light of the spread of the disease, there are grave concerns that the outbreak has evolved from a regional to an international crisis. As we have already witnessed, in today's interconnected world, Ebola is a threat that can easily land at any nation's doorstep. I'm therefore pleased to see that the international community has wasted no time in responding to the call for action. Many member states have come forward with generous pledges of support, both in terms of financial assistance and in-kind contributions. For these efforts, member states deserve thanks and deep appreciation. Furthermore, UNMIR teams have already been deployed to the mission headquarters in Ghana and launched their response efforts in the most affected countries. In a situation where each day potentially means lives lost. The rapid response of UNMIR supports the implementation of critical prevention and containment measures. Yet, while the initial response from the international community is commendable, much more needs to be done and to stem this public health crisis. In this context, I urge member states to follow through on their commitments and pledges of support. As we have said all along, addressing the crisis requires bold, urgent, and coordinated action on the part of the international community. Your pledges of support are a vital component of the global response. Beyond commitments already made by member states, I also encourage concrete proposals on how the global community can support those most affected in terms of financial, humanitarian, and other requirements. Given the unprecedented nature of the epidemic, the international community must work together to come up with innovative yet practical solutions to contain further spread of Ebola. In this regard, I urge member states to remain seized of the evolving situation and share specific proposals on how to improve, hasten, or streamline response efforts. Even for those member states who have already made contributions, more is needed. Let us use this opportunity of this briefing to make more pledges. I thank you for your kind attention. I now give the floor to the Deputy Secretary General of the United Nations, His Excellency Jan Eliasson.
Mr. President, Excellencies, ladies and gentlemen, I first of all want to thank you, the President of the General Assembly, Sam Kutesa, for convening this crucially important and timely meeting at which I have the honor to represent the Secretary General who is on travel. Let me state from the very beginning, our response to the Ebola epidemic must be swift and effective to match the scale and urgency of the challenge. Now is the time for action. We must catch up with the menacing exponential curve of the virus. The crisis is multidimensional, with serious effects not only on public health, but also on food security, on social cohesion, on economic and social and political stability. Hard-won development progress is in jeopardy. Neighbors are at risk. None of us are insulated from the threat posed by Ebola. It is a global concern and demands a global response in compassion and solidarity with those affected. That is why the Secretary General formed the Global Ebola Response Coalition to galvanize international action, as well as the UN Mission for Ebola Emergency Response, UNMIR, to coordinate action on the ground. The Secretary General and I thank the General Assembly and also the Security Council and Member States for decisive and generous support for these initiatives. This morning, I presided over the first meeting of the core group of the Global Ebola Response Coalition. We noted a wide range of actions and commitments to stop the epidemic and discussed how we most effectively can catalyze action. But let us be clear, while the UN has stepped up to play a coordinating role, we cannot do this work alone. No country, no organization can. This crisis requires collective mobilization outside and inside the affected countries, as the President just stated. Here I would like to pay tribute to the courageous work of local health workers since the very onset of the outbreak in March. Many national health workers have lost their lives. Others also working for organizations such as Médecins Sans Frontières and the International Federation of the Red Cross and Red Crescent are selflessly risking their lives. So too are our colleagues from many agencies, UN agencies. Defeating Ebola is going to demand the best efforts of all of us working together. Governments, multilateral development banks, international and non-governmental organizations, and many others. We must work in concert to support the affected countries to implement their national response strategies for Ebola. To that end, we are rapidly deploying people and assets and are working with unprecedented collaboration and speed. We are guided by 5 simple commands. 1, stop transmission. 2, treat those with Ebola. 3, ensure essential services. 4, preserve stability. And 5, prevent further spread. The UN peacekeeping mission in Liberia, UNMIL, and all UN entities in the affected countries have been providing critical assistance for many months. They are continuing to partner with the unified framework provided by UNMIR. On 29th of September, SRSG Banbury arrived at UNMIR's headquarters in Accra with an advance team. He has just finished a week-long assessment visit to the 3 most affected countries, Liberia, Sierra Leone, and Guinea, to assess how UNMIR can best augment international and national structures and programs without duplicating them. The Secretary General has just appointed Ebola crisis managers for each country, and he is in regular contact with the 3 presidents of the 3 most affected countries. As Special Envoy, Dr. David Nabara at my side remains fully engaged in efforts to forge strategic partnerships through the Global Coalition to achieve the massive scale-up of financial and in-kind resources that is so urgently needed. There are now over 80 newly deployed UNMIR staff in the mission area, with more on the way, but many more staff will be needed to reach those areas where support is most needed, especially at the district level of the 3 countries. I now appeal to all member states to act generously and swiftly. Speed is of essence. A contribution within days is more important than a larger contribution within weeks. Recent cases of the virus outside the region have shown that this is a global crisis. But the answer is not to close borders or impose travel bans. Such measures will isolate the affected countries, not the disease. They will prevent urgent aid from reaching those in need. We need international solidarity in the face of an international threat. And the Secretary and I are grateful for the growing number of financial and in-kind contributions flowing in. Over $20 million has been raised for the Multi-Partner Trust Fund in the last week, but we need more. We need much more. Of the $1 billion sought by UN agencies under OCHA's consolidated appeal, only 1/4 has been funded. We also need a surge in trained healthcare personnel who can deploy the staff to staff Ebola treatment units and Ebola community centers. And here we have some very important contributions from member states like Cuba. We need to make medevac available to healthcare and humanitarian responders and provide the necessary assurances for a surge of personnel to be deployed. And we need dedicated treatment facilities for all healthcare responders in country who continue to work at great personal risk. We must aim to achieve quality care for all affected citizens of Guinea, Liberia, and Sierra Leone. We should also recall that with the crisis in the health sectors in these 3 countries now, there are so many people who are not getting normal medical help. The hospitals are overburdened, and people are even worried to go to the hospital. So you can imagine the number of people that are suffering and maybe dying from other diseases, malaria, tuberculosis, all the things that we normally treat. That is not part of our statistics yet. We must also work to generally strengthen, therefore, the health sector and, of course, now make sure they have food security and stronger regional preparedness. In closing, Ebola is an unforgiving and a frightening disease, but it can be defeated if we work together in solidarity and with effective coordination. Every hour counts. Every contribution counts. The people of the world are watching. The people of West Africa now to a great deal depend on us, although, of course, the national ownership is absolutely crucial. Let us give them hope. Let us be at their side. Let us end this crisis swiftly and decisively. I thank you, Mr. President.
I thank the Deputy Secretary General of the United Nations for his statement. I now give the floor to Dr. David Nabarro, Special Envoy of the Secretary General on Ebola.
Mr. President of the General Assembly, Mr. Deputy Secretary General, Chef de Cabinet, Excellencies, ladies and gentlemen. First of all, I would like to acknowledge the really important role of this global body in focusing attention on and leading support for the response to the current outbreak of Ebola. In my remarks, I'd like to cover 6 points. I'd like to talk a bit about the history of the outbreak. I'd like to focus on its significance. I'd like to reflect on some of the actions being undertaken now to scale up the response. I'd like to concentrate on the different partnerships that are being built, the leadership of different bodies, in particularly the presidents of the countries, and then the coalition that has been referred to in the Deputy Secretary General's remarks. I'll be followed by Anthony Banbury, who will give a more specific presentation on the work of the United Nations mission for Ebola emergency response. Let me start a bit with some history. I've worked as a public health doctor for 35 years, and I've been involved in many disease outbreaks and indeed some pandemics. But I've never encountered a challenge like this one in my professional life. The reason is that this outbreak has moved out of rural areas and has come into towns and cities. It's no longer just affecting a very defined geographical location. It's affecting a whole region, and it's now also impacting on the whole world. And this outbreak is advancing quite rapidly ahead of the control effort. And the rest of us are having to work really hard to catch up and overtake it. But we know what's got to be done, and together we're going to do it. And our commitment to all of you is to achieve it within a matter of months, a few months, rather than going slow and letting the outbreak cause a lot more harm and misery. So my second point is about the significance of the outbreak. It's got into societies in West Africa in a very deep and worrisome way. For many of the communities that are currently affected, the day a person dies is the most important day of that person's life. That's the day when the spirits move from the person into friends and relatives, into the community. The day of death must be treated with proper respect and ritual. Otherwise, it undermines the very fabric of society. Yet people who are dying of Ebola are very dangerous. And if they're touched, and if they're held at that moment of death, they can infect large numbers of other people because their bodies are toxic. Their bodies contain the virus. It's often on the surface of their bodies. So unfortunately, the time of death has proved to be a time when the virus tends to spread very widely. And in order to get control over the virus, people are having to change the ways in which they handle illness and handle death, and to move away from traditions that are centuries old. This has been a major difficulty for many of the societies that are affected. And it's really only in the last few weeks, thanks to the courage of the leaders of the countries concerned, that there's been a much greater emphasis on people coming to terms with and owning the disease and changing their behaviors so that they're less likely to spread the disease. Another phenomenon that's occurring is that when people get the disease, they get scared, and they tend to run to people who they think that can help them. Traditional healers, centers of faith, or even friends and relatives. And that in turn leads to the movement of sickness and the disease into new communities, new chains of transmission. And that has led to the widespread dissemination of the disease and the virus. Third point, how then do we respond as the disease spreads? Well, we have to recognize it's spreading very rapidly, probably doubling in numbers of cases every 3 to 4 weeks. And that means a huge provision of treatment facilities for people with the disease, a great increase in community centers, a lot of work with societies to help them respond to the disease and others to help them get prepared. A massive social mobilization on an enormous scale, not just in the most affected countries, but in neighboring countries as well, and indeed throughout the world. And this going to scale so that everybody knows about the disease, knows how to prevent it, knows where treatment is available, involves thousands of health workers from all over the world, thousands of community mobilizers, and hundreds of people to help construct centers and staff them and make sure they're properly supported. This going to scale, perhaps increasing the level of response 20 times greater than it was at the beginning of this month, involves just about every country in the world, certainly every donor agency in the world, many non-governmental organizations, all working in support of the presidents and people of the affected countries. Because without that mass mobilization, without a global movement, it will be impossible to get this disease quickly under control, and the world will have to live with the Ebola virus forever. And that's why your leadership and the leadership of the Security Council, the leadership of the presidents, the leadership of the chair of the African Union, the leadership from ECOWAS, and I'd like to particularly single out the decisive role played by the Secretary General of the United Nations in recent weeks, gives me some hope that we now have the mechanism to bring together all the different partners to scale up action and to achieve results rapidly. We will continue to need and request resources from all of you, doctors and nurses to come in as teams to help staff treatment centers, aeroplanes, helicopters, vehicles, motorbikes, boats to provide the transportation necessary for logistics systems that go deep into the villages and the townships of the affected countries, and also to provide preparatory expertise into neighboring countries. And we will continue to ask you for cash, because this is an expensive job, because it requires contracts and arrangements that have to be set up now so that we get the scale up as quickly as possible. And that's why we're super grateful to everybody for contributing to the Trust Fund. The last point about the coalition. This virus can find its way through defenses, especially if there are holes in defenses. It can find its way often inside the body of infected people, into transportation systems if there are not strong defenses there, It can find its way from village to village and town to town if people are frightened and are not provided with proper care. And that's why we are seeking to encourage all who are responding to come together in a coalition which will be facilitated by the United Nations. The Deputy Secretary General will chair it, and which will help all of us to work together, knowing what each other is doing and keeping regularly informed. It is the most extraordinary challenge that the world could possibly face. You sometimes see films about this sort of thing, and you imagine, how could such a thing happen? This is more extreme than any film I have ever seen. This is a real challenge to all of us that's going to require every piece of ingenuity and collective action that we can mount to work to respond to it. Because the enemy, in this case a virus, a tiny microscopic thing, is invisible to our eyes, and many of us don't understand it. So we have to be prepared to respond to whatever it brings to us. And I thank you for making this possible. Thank you, sir.
I thank the Special Envoy of the Secretary General on Ebola for his briefing. I now give the floor to Mr. Anthony Banbury, Special Representative and Head of the United Nations Mission for Ebola Emergency Response, who is joining us via video conference.
Mr. President of the General Assembly, Mr. Deputy Secretary General, Chef de Cabinet, Excellencies, distinguished delegates, thank you for giving me the opportunity to brief you today on the activities of the United Nations Mission for Ebola Emergency Response, UNMIR. I'm grateful to you, Mr. President, for your leadership on the Ebola crisis and for convening this session and for ensuring that the response to fighting the Ebola epidemic remains on top of the global agenda. I also wish to thank Dr. Margaret Chan, Director General of the World Health Organization, and all the UN agencies, funds, and programs for their support, both in terms of material and personnel, to UNMIR. Since the establishment of UNMIR on 19th September and its immediate and welcome endorsement by the General Assembly, the Secretary General made clear his expectation that the United Nations system move rapidly and decisively in responding to the Ebola crisis. And we have been moving swiftly on a number of fronts. My colleague, Dr. Nabarro, has detailed his efforts in building a global coalition to respond to this disease. He and I are working together closely. Dr. Nabarro is leading the international effort to garner support for the fight. UNMIR, with the help of multilateral and bilateral partners, is concentrating on operational crisis response activities on the ground. Both planks are integral to a comprehensive strategy to fight the disease. Following my appointment by the Secretary General, I deployed to the region with a small but now growing team to start up the mission. I am particularly grateful to the government of Ghana for hosting UNMIR's headquarters in Accra, which has immensely facilitated the work of the mission. In rapid succession, I have visited the three most affected countries, Liberia, Sierra Leone, and Guinea, for 2 days each. I went on the trip to listen, to learn, and to identify areas where UNMIR can be most helpful and to find ways in which it can accelerate the response to the crisis. I met there with President Ellen Sirleaf Johnson of Liberia, with President Ernest Bai Koroma of Sierra Leone, and with President Alpha Condé of Guinea. I also met with government ministers and officials, with civil society actors, women's groups, NGOs, the UN country teams, and the diplomatic community. I had the opportunity to visit 2 Ebola treatment centers, 1 holding center for patients, as well as a WHO training center. My firsthand impressions were vivid and deeply worrying. We saw how brave, tired, and immensely dedicated national and international health workers are carrying on under extremely difficult circumstances. Over 230 of these health workers have died in Liberia alone. We saw people and resources stretched to the limit, with more being done with less than can be considered acceptable. We saw families grieving for lost ones, but also fearing for their own health. We saw a patient being turned away for lack of beds at the facility. We saw a woman lying dead in a street, unattended. The human response is to care, to empathize, to pay respect to the departed. With Ebola, this type of response can be fatal. To defeat the virus, we will have to change behavior. Excellencies, the consequences of this disease are catastrophic. In order to fight it, UNMIR shall be guided by the following principles. First, our top priority is to keep our staff healthy, without which no effort shall be possible. Second, we must support national efforts and national leadership. Third, the work of UNMIR must not replace or duplicate national plans. And fourth, the response of this mission must be tailor-made to each country and its unique circumstances. Above all, UNMIR's focus and all our individual and collective efforts will be on bringing this crisis to an end as soon as possible. And as soon as our task is completed, UNMIR will close its doors. We must also concentrate on prevention and preparedness in other countries. Preventing transmission to and within other countries will be a critical component of UNMIR's mission. Collectively, we must stop the spread to other countries and ensure that countries are prepared to rapidly detect, control, and eliminate the virus if it is introduced. For all of these efforts, we shall collaborate closely with the African Union, the Economic Community of West African States, and the Mano River Union. I had the opportunity to meet with the AU Commissioner for Social Affairs and the head of the AU Support to Ebola Outbreak Operation in Conakry 2 days ago. I commend the African Union's deployment of health workers to fight this disease, and I hope that others will follow their lead. Mr. President, Excellencies, allow me to present some of the findings and conclusions at the initial phase of the mission's deployment. The crisis caused by the outbreak of Ebola is severe and unprecedented. The world has never seen anything like it. Time is our enemy. The virus is far ahead of us, and every day, the situation gets worse. Almost 3,900 people in 7 countries have died. But the Ebola epidemic is not just a health crisis. It is a complex, multidimensional crisis in 2 main ways. First, it is having a broad impact on the societies where there's an outbreak. It kills people, it destroys health systems, it harms economies, it disrupts education systems, food security, and livelihoods. The 3 most impacted countries have recently shown some of the highest growth rates, economic growth rates, not just in Africa, but in the entire world. Now the growth rates may be halved or even more in the course of a year. Second, the response necessary to end the crisis requires intense efforts across multiple sectors, not just health, such as logistics, and perhaps even more importantly, social mobilization, as Dr. Nabarro was talking about. There are intricate complexities surrounding issues such as burial practices. Excuse me. Many people in the affected countries still live in denial that Ebola is real. Many resist changing age-old practices. In such scenarios, science can help, but it is insufficient. We must understand and respect different cultural values, social practices, and mores, and find solutions that on the one hand protect people from infection, while on the other will be accepted by the affected communities and families and individuals. In my short time in the region, it is clear that one of the greatest needs is comprehensive crisis management. Much good work has been done since March by national governments, United Nations agencies, NGOs, but it has been a patchwork of good work. The crisis needs to be managed like the complex, multidimensional regional crisis it is, not just as a health crisis. Excellencies, the challenge is immense. UNMIR's work began only 2 weeks ago. We are late, but it is not too late still to fight and win this battle. UNMIR has deployed to 4 countries. We have deployed staff, vehicles, planes, helicopters, and communications capabilities. We are moving resources to where they are needed most, with strong support from UN agencies. This is what UNMIR will do. We shall support national leadership and national ownership. We shall play the role of crisis manager and not just coordinator. Our heads of missions in the 3 affected countries are Ebola crisis managers. We shall work with host governments to ensure that there is a comprehensive plan in place to stop Ebola. Each necessary line of action to implement these plans will be identified, and each line of action will be assigned to an organization with clear timelines and clear accountability. We shall fill gaps. We shall support that which needs backstopping, but we shall not be the only player in fighting this fight. Everyone must play their part. Most importantly, we shall work with a wide range of partners, anyone who can make a contribution to ending the crisis. The crisis is unprecedented, and it requires an unprecedented, creative, rapid response to bring it to a close. Our priority shall be to accelerate action. To achieve results fast, we must have your and the world's support. In particular, first, the highest priorities are Ebola treatment centers with skilled managers and medical personnel. Second, we need diagnostic laboratories. And aid agencies need financial support. It just can't be that aid agencies willing to contribute to this effort are unable to do so for lack of financial resources. And we need reliable arrangements in place to treat and, if necessary, evacuate aid personnel working on the crisis. I would like to add here that the crisis faced by the country should not be compounded by isolation. Countries and airlines should maintain open links with the affected countries and the region so that we isolate the virus and not the country. Let me take this opportunity to thank the General Assembly for its rapid approval of the budget of UNMIR until 31 December 2014. As I noted earlier, when this crisis is over, UNMIR will close. But the United Nations agencies, funds, and programs, and other partners will have much work to do in supporting the countries affected recover from the crisis, to help them build structures and resilience so they never again fall victim to such a disaster. Even now, as we focus on the emergency, we need to be incorporating early recovery and long-term needs into our efforts. Mr. President, Excellencies, the Ebola crisis is an emergency of profound consequence and grave risk. There is no other way to describe it. Like Special Envoy Nabarro mentioned, in my career, not as long as his, but nonetheless a long one, facing many crises, I have never seen such a terrible, difficult challenge. The world must now act to help the people and governments of Liberia, Sierra Leone, and Guinea, and by helping them to help the rest of the world. A failure to act now, while we have the chance, could lead to unpredictable but very dire consequences for the people of the countries and well beyond. As long as there is one case of Ebola in any one of these countries, no country is safe from the dangers posed by this deadly virus. UNMIR is on the ground, and we are committed to doing our job. We are doing it now, but UNMIR cannot do this alone. Neither can any single country or actor. We need a broad global coalition, as the Secretary General, the Deputy Secretary General, and Dr. Navarro have called for. The whole world must contribute, and each country should contribute what it can. It is only by working together and fast and inventively that we can end this crisis. We must rise to the occasion. We must defeat this disease. Thank you.
I thank the Special Representative of the head of the United Nations Mission for Ebola Emergency Response for his briefing. Before proceeding